Let's see if this is working. Perfect. The glare is intense this morning. Let's try this. Okay, see if that's any better at all. Not so much here. Let's just see what we can do. All right. Okay, a little bit better. My camera on the computer is just a little dirty. So lovely. Well, welcome to another chat that we're going to do this morning. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, and thanks for joining me today. So, our last episode last week, we talked all about incontinence. So, leaking and peeing when you don't want to be. Okay. So, we're talking about when you exercise, cough, laugh, sneeze, jump, you pee your pants, or you leak a little bit. Okay. So, not ideal, and definitely something a lot of women deal with. But today I thought it would be fun to sit back and let's chat about correcting your bladder or correcting the incontinence with surgery versus correcting it with pelvic floor PT. And let's weigh out these options because a lot of posts that I see online are like, oh, I got a bladder surgery. It's the best thing I ever did. And then some people are like, I got a bladder surgery. It's the worst thing I ever did. I went to pelvic floor PT and it worked for me. Someone else can be like, I went to pelvic floor PT and it didn't work for me. So I want to just evaluate this a little bit in this conversation and talk to you about why you're seeing these extreme differences. Okay. So let's just start here by talking about what approach do we want to take? Let's talk about incontinence. Okay. So let's just go through again really quick. We talked about it in the last episode. If you leak pee at all, go check out the other episode before you listen to this one, because this is all about the treatment and solutions. And we're talking about a surgical approach versus a holistic treating the body, healing the body approach without surgery or without medication. Okay. Oh, and medication could be on our list, but today we're really going to compare. Let's compare surgery because I feel like that's the most common, and then pelvic floor PT, which is also the most common. So two very common treatment techniques to fixing someone's bladder. And so we talk about it as fixing someone's bladder. We market it that way because that's what a lot of people are Googling. But truly, incontinence can happen for many different reasons, as you learned about. It can happen because you have a pelvic organ prolapse. So it can happen because your bladder is hanging a little lower. So your bladder literally comes down into the vaginal canal. Or it can happen because your uterus is coming down into the vaginal canal and it's putting pressure on the bladder, because the uterus sits right on top of the bladder. Or it can be happening because you have constipation. So all those reasons can cause incontinence, can cause stress urinary incontinence, can also cause urge urinary incontinence. So that means that it can just cause you to pee. Okay. So all those reasons. All right. Now, other reasons that can cause urination when you don't want to be is a tight pelvic floor. So a tight pelvic floor is sometimes called a hypertonic pelvic floor, and that's a pelvic floor that's very contracted and doesn't know how to relax very well. So maybe this pelvic floor is just really good at doing Kegels and stuck in a Kegel all day long. But that is going to make it hard to hold pee when you actually go to jump and try and cut that pee off from leaking. So that can be a cause of incontinence as well. So a hypertonic pelvic floor. Okay. Other things that can cause a pelvic floor to be, or can cause you to be incontinent, can be uh, scar tissue. So scar tissue in a muscle can prevent you from contracting that pelvic floor. You can have abdominal pressure that is just really high and puts force down on the pelvic floor. So maybe every time you go to lift weights, you maybe take a big inhale and then do your lift. So a lot of people will do that kind of breath in order to lift really heavy weights. And that type of breath can put a ton of downward pressure on the bladder and cause you to leak. So these are just some reasons, a few reasons really. And so tightness and then weakness. A tight pelvic floor is a weak pelvic floor, truly, because it can't go through the full range of motion. But if it's completely weak pelvic floor, so just not able to contract at all, just kind of stuck in this lollygag position, maybe you've never even felt yourself do a Kegel, or you're just kind of stuck and you're not able to initiate any force from that muscle, that can also cause incontinence. So there's all of these reasons that can cause incontinence. So, a pelvic floor PT, a pelvic expert PT, someone who truly specializes in this, is going to be someone who looks at all of these things and goes through all of the systems to see, okay, is your bladder in a funny position? Is your uterus causing this incontinence? Or is it because of constipation? Or is it tightness in your pelvic floor? Or is there scar tissue? Or did you have old abdominal scar tissue and that's what's causing this? So a really or it can be alignment. So if your hips are off or your ilia have some rotation and the muscles can't fire together synergistically, that can cause incontinence. Or your hips can be very weak and then and that can cause a ton of force through your pelvic floor. And so your pelvic floor gets tight trying to hold it together. This is all reasons. This is very clinical and you don't need to pay attention to that. I just think it's important that I go through that because we're talking about many different things that contribute to incontinence. And your doctor of physical therapy, your pelvic expert physical therapist is going to know to look at all these systems. Okay. So when you start to heal these systems, then you start to improve your incontinence. Ideally, that's what it is. There's also behavioral techniques, limiting bladder irritants, making sure your water is adequate, your water intake, and you're not having too much water or too little water. There's all different contributing factors. And so a great PT is going to look at all of that and treat all of that. They're not just going to stick little electrodes on your anus or perineum and tell